Hey guys, welcome to Man Medicine, where we talk about how men can optimize their health and escape the collapsing U.S. healthcare system. So, a little article came across my desk a little while ago from Medscape.com, which is like a medical news site, and it really disturbed me a little bit, and I want to share it with you guys today. And when I read it, I just couldn't help thinking about the old phrase of like, this is why we can't have nice things. All right. There's always somebody that's ruining a good thing for the rest of us. And that's exactly what I was thinking about when I saw this article. So this one is the name of the article. I'm sorry, the news article. I'll talk about the study and I'll show you that in a second. But the article in Medscape was called "Getting Testosterone Online is Easy. Solid Advice, Not So Much," by Marcus Banks, published just this past December. And just to summarize real quickly, what this article talked about was a recent study published in JAMA Internal Medicine, where essentially they sent like an undercover patient into like various online telemedicine-based men's health / testosterone practices, and they evaluated whether these particular clinics were following established endocrine society or AUA, American Urological Association guidelines, for the prescription of testosterone and treatment of hypogonadism. And, shocker, of course, they weren't. But that wasn't really the main problem. That's not what disturbed me at all. In fact, quite honestly, there are a huge number of men that benefit from therapeutic testosterone that fall outside of those guidelines. And most endocrinologists and urologists will readily concede that there are men outside of these ultra low levels that classify for the diagnosis of hypogonadism that do still stand to benefit. That's not what bothered me. It's some of the other things in the article that I'm going to share with you that were just like, not just poor care, but I'm not going to say they were malpractice, but really did not look, it wasn't a good look for these clinics. And what really concerns me about this is that, this was published in a big journal. It gets a lot of readership, and there has been an increasingly vocal and quite prominent group within the endocrine world and in urology as well that is increasingly sort of pointing the spotlight at these testosterone clinics for not following guidelines, and they are in some cases, pushing for stricter regulations on the prescription of therapeutic testosterone to men. Now it's already a Schedule III controlled substance, which puts it right up there with different kinds of opiates. You have to take it seriously. But some of these voices in these communities are really wanting to restrict it to essentially just endocrine or urological association guidelines, and essentially prevent or forbid prescription of testosterone outside of those guidelines. To the point possibly, where a physician's medical license could come at risk if they were to deviate from those guidelines. Now, those voices aren't super loud right now, but articles like this, when they get published, are going to make those voices louder, and it's going to make life difficult for physicians out there who are prescribing testosterone for men, and they're doing it thoughtfully, conscientiously for medical indications that are appropriate, and are monitoring their patients properly. And essentially, if legislation like that comes into play, where prescribing testosterone outside of these guidelines is forbidden, or whether there's a lot of extra scrutiny when a doctor writes a testosterone prescription, what's going to happen is they're just going to stop prescribing it. They're just like, I don't want to take the heat from a medical board. I don't want to take the risk. There's already a lot of doctors that feel that way. They're just like, I want nothing to do with testosterone therapy. But certainly that could potentially get a lot worse if some of these voices that I mentioned, have their way. So let's go into the study here a little bit. Like I said, it's from JAMA Internal Medicine. I wasn't able to get the actual full paper because it's still behind a paywall, but I was able to take some screenshots of like some of the important details of this. And this was just published last month, actually, December 2020. So it's called Guideline Discordant Care Among Direct-to-Consumer Testosterone Therapy. So let's see what they talk about here. So, they just talk about how like testosterone therapy, it's an over $400 million a year business. And so all of these new direct-to-consumer practices have popped up everywhere via telemedicine and, are prescribing testosterone to men like all over the country. So they talk about the fact that, direct-to-consumer medicine is generally a good thing. So they use examples of, helping men get treatment for erectile dysfunctions. There's companies out there that will send you, generic Cialis and Viagra, et cetera, via a telemedicine platform. Same thing with for hair loss, like they'll send you Propecia, that sort of thing. And they say that that's a good thing. But what they say here is, however, unlike pharmacotherapy for erectile dysfunction and androgenic alopecia, testosterone is a class 3 controlled substance associated with increased risk of infertility, polycythemia, and possibly cardiovascular events, with the latter prompting multiple safety communications from the U.S. FDA. So the one thing you'll see in the voices I mentioned earlier is that there is in my opinion, perhaps an overemphasis on the risks of testosterone therapy. If you listen to my channel, I think I cover those in depth, at least as much as I can, and I'm going to continue to do that as more information comes out. But there are risks clearly, but in many times they're overstated, and many physicians who are not well versed in testosterone therapy still believe that testosterone leads to blood clots, DVTs, strokes, etc. That it increases your risk of cardiovascular disease, all those sorts of things, which the bulk of the literature shows is not true. But regardless, they said, given the potential risks of testosterone therapy, we sought to examine whether direct-to-consumer platforms provide appropriate guideline concordant care for testosterone therapy. All right, so what did they do? So they whittled it down to, they found 7 companies or medical practices that did direct-to-consumer men's health / testosterone, via telemedicine all over the country. And they didn't name who they are, and even if they did, I wouldn't put it up here because it's not important. So they said 7 companies underwent, they called them secret shoppers, not undercover agents, which is what they really were, but 7 companies underwent secret shopper assessment, wherein the secret shopper, the initials were JMD, used a script to inquire about and initiate the process of testosterone therapy. Okay, so what they did is they deliberately made some pitfalls to try to trap these clinics into doing things that they shouldn't be doing, and they fell for it hook, line, and sinker. So the script described a hypothetical 34-year-old man, so already somebody relatively young, okay, with low energy, low libido, okay, could be an androgen issue, who was interested in future fertility. And they put that in there knowing that these clinics would probably just completely ignore that and not properly counsel the patient on the risks of fertility, the risk to their fertility. And sure enough, they didn't. So what they did is that in addition to completing the intake evaluation, the secret shopper completed all required testing at an independent laboratory, which they said ended up being LabCorp, and the initial telemedicine consult for each platform. Okay, here's the first red flag. In all of these cases, the initial consultation was conducted by a nurse practitioner, physician assistant, or, here we go, big red flag, non-medically licensed individual. So like some of these clinics call them like patient care advocates. So it's not the nurse practitioner, physician assistant part of that that's disturbing. It's this non-medically licensed individual. And you better believe that if the FDA or the DEA is seeing a pattern where clinics are using non-medical licensed individuals to perform evaluations on men who are then being prescribed Schedule 3 controlled substances, you better believe that they are going to drop the hammer on that. So if you're seeing a clinic where you don't see you don't see a doctor, you don't see a PA, you don't see a nurse practitioner, and you're just dealing with some sort of a patient advocate, first of all, I mean, I would question whether you're getting good care. Second of all, I would be concerned that that clinic is not going to be in business much longer if stuff like this, continues. So, moving on. Despite reporting normal total testosterone levels, they said 675 nanograms per deciliter, solidly in the normal range, and a normal free testosterone, which was, so 10 picograms per ml, solidly normal. And desiring fertility, the secret shopper was offered testosterone therapy by 6 out of 7 platforms. Okay, it just gets worse. Now let me stop right there. There certainly could be a case for someone with numbers like that could benefit from therapeutic testosterone. Okay, I'm not going to go into all of those, but I will tell you though, as a physician, if you're prescribing testosterone to people with those kind of numbers, you better have some really good documentation, and you better have a really good medical justification for why you're giving someone testosterone. Because if an endocrinologist from a medical board looks at those numbers, they're gonna be like, okay, you can't justify giving someone with those kind of numbers testosterone, and you need to be able to justify that if you're going to do that. And I tell you, it's going to be a hard sell. It's going to be a hard sell. It doesn't mean that the patient is not going to benefit, but these boards are not going to look favorably necessarily on that. Okay, so let's move on. So this is going to detail the really shoddy evaluation that this secret shopper got. Only 1 in 7 platforms inquired about recent cardiovascular events or desire for future fertility. Guys, that's just like basic. Wow, yeah, I'm just shocked. Criteria for offering testosterone therapy were discordant with Endocrine Society and American Urological Association guidelines. Yes. Let's see here. Only one platform declined, and they said that they only treat men if they're below 450 nanograms per deciliter. Okay, all the rest of them were happy to give this guy testosterone, and they said that they had no total testosterone threshold for initial treatment. So they didn't care how high it was. If it was 1,000 for your total, they'd still give you testosterone. Okay, difficult to justify. All right. Where are we at here? Half of the platforms offering testosterone therapy stated a treatment goal of a total testosterone level of 1,000 nanograms per deciliter. So they told this secret shopper, we got to get you up to 1,000. That's the goal. So that's again a huge red flag. If I hear a provider say that, it just tells me they don't understand testosterone. The goal, a number is not a goal. Symptom resolution and health improvement is the goal. It's not a number. It's not I have to get you to 1,200 to 900, 700. I don't care what your number is, as long as it's within normal limits. I want you to feel better, and I want your health conditions for which I prescribed you testosterone in the first place to improve. Okay, so 3 out of 6 said we got to get you to 1,000. So there's no evidence to support that. It's bad medicine and just doesn't make any sense. Okay, and then said did not discuss the fertility risks of testosterone therapy, which this guy in his intake said. So first of all, he's a young guy, actively wants to have children, and they didn't even mention the fact that starting on testosterone therapy, unless he's taking HCG, HMG, something along those lines, is going to plummet his testosterone and, plummet his sperm counts, and very likely make it impossible for him to father a child. All right, big problem. Okay, 5 out of 6 did not discuss the risk of polycythemia. I don't even know what to say about that. That's all of this stuff is. There's a standard checklist, that you need to go through if you're going to prescribe somebody testosterone. And most people come in, they already know the benefits, but you really have to go into detail on the risk, and you have to cover everything. And polycythemia and fertility implications is like number 1 and number 2 on that list. Okay, and 5 out of 6 didn't even mention it. And then, of course, here we go. The secret shopper was offered a broad range of off-label medications in addition to testosterone therapy. Table 1. Unfortunately, I don't have Table 1 to show you because, again, I couldn't I didn't want to purchase the article. I'm cheap, but I can already guess what some of this stuff was. Probably anastrozole, probably a variety of different peptides, probably a bunch of other like nutritional supplements, et cetera, et cetera, et cetera. None of which necessarily are beneficial or indicated, but certainly make a lot of revenue for these clinics. Okay, let's finish this up here. So they says this cross-sectional study found that direct-to-consumer platforms offer testosterone therapy and off-label therapies to men not meeting guideline-based criteria. Okay, that's not the problem here, in my opinion. Again, as I mentioned before, it is often appropriate to prescribe testosterone for men who don't quite meet these strict guidelines, but who have other medical indications. The problem was their evaluation of this guy and their discussion of the risk, benefits, and alternatives for testosterone therapy was essentially non-existent. And that's a huge red flag. Not to mention the fact that a lot of these clinics provided initial intakes from people who weren't even medical and had no medical training, essentially. So that's a bit frightening. My personal advice to you guys is your initial intake from a clinic, I think, and feel free to argue with me, I think should be done by a physician. And then subsequent care, follow-up care, et cetera. If it's going to be a nurse practitioner or PA, that's fine. There are certainly PAs and nurse practitioners out there who have done the extra training, who are excellent and could take things, right out of the gate for you. But especially if you have any sort of complex medical history, it's my personal bias. I think you should be evaluated by an MD or a DO initially, and then, at that point, certainly supervised care from a nurse practitioner or a PA, would not be inappropriate, in my opinion. Okay, so they just said here, almost all the clinics used providers with unclear oversight and failed to convey risks and benefits of testosterone therapy. You better believe it. And then here they said, future policy initiatives may also facilitate delivery of more consistent guideline-based care by these entities. So that's code, in my opinion, for we need to pass some laws to drop the hammer on these clinics because they're not doing things correctly. And, they're not wrong in saying this. These clinics are they're giving the rest of us in this men's health area a really bad name. And, again, this is why we can't have nice things, because there's a small number of these fly-by-night windmill TRT clinics out there that are using inappropriate protocols. They're not doing proper history and physicals, and they are it sounds to me like they're just trying to turn and burn and get patients in and get as much money as they possibly can in the shortest period of time. And that's, in my opinion, that's not good medicine. So that's all I have for you guys today. This is not good. I had a feeling, that this is kind of the state of the testosterone space right now, is that there's a lot of these shady clinics all over the place. And unfortunately, if this kind of care keeps up, I have a feeling that this little secret shopper event, which was not not from the FDA, not from the DEA, this could very easily prompt a much more thorough investigation with true undercover agents from the FDA or possibly even the DEA engaging with these clinics, and God knows what they're going to find. And then that's going to be just enough ammunition for some of these voices that want to clamp down on testosterone prescriptions to pass that kind of legislation. And again, at the end of the day, who suffers from all of this stuff? It's going to be men who would have benefited from therapeutic testosterone. So it's unfortunate. I hope that doesn't come to pass, but we got to find a way to get these clinics either to change their policies or get them out of business. I don't think it's good for men. So that's all I have today. On that positive note, we'll catch you guys later. All Man Medicine video and audio has been created and shared online for informational purposes only. This podcast does not constitute the practice of medicine or professional healthcare services of any kind, including the giving of medical advice. I am not your doctor. No doctor-patient relationship has been established. This content is not meant to be a substitute for professional medical advice and should not be relied upon solely for that purpose either. The only purpose of this content is to present peer-reviewed, research-backed health information for your consideration. As always, rely on the advice and guidance of your personal physician before undertaking any activity presented here, and if in doubt or not comfortable with said activity, practice discretion. Your health is your responsibility and not ours. Finally, I take conflicts of interest seriously. I accept no compensation whatsoever from any private corporations, including pharmaceutical or supplement companies. You can trust that if I recommend a medication, product, or service, it's because I genuinely believe in it and not because I'm being paid to endorse it.